Well, welcome back to another episode of The Daily Dose, where we like to tell everyone little tidbits and pearls about all things med spa. I'm Dr. K.
And I'm Samantha.
And we are very excited today to talk a little bit about what happened to me.
Let's talk about it.
So maybe we need a little zoom in on my beat up face. If you take a close look, you'll see that I've got some redness around my eyes, a little swelling around my eyes.
Some stamp marks.
Some stamp marks around my eyes. Definitely not a good look for me right now. But it's because, what did you guys do to me yesterday?
We use a device called the Tixel.
Tixel.
Yeah.
Tixel?
Yes.
Now, is that a laser?
No.
What? Wait a minute. You told me you were going to laser me.
Well, we did that too.
Well, the Tixel is a very interesting device. It's actually one of our energy-based devices. And it is great because it technically is a little different from a laser, but still gives us some rejuvenating effects. And it's very, very useful in certain areas, especially around the eyes.
Yeah. So it's a mechanical action. So it heats up to about 400 degrees. But
400 degrees. Like that's what you have to heat the oven up to like cook. I don't know. That's what we make our mac and cheese at, 425.
It's hot.
Jeez.
Yeah.
So that thing gets up to 425. Mm-hmm. So what's it do?
So it has like a little tiny like pyramid shaped tip, and it's hot. And I mean, we describe it kind of like a flat iron, if you will.
But with a bunch of tiny little like points, right? Basically.
Yep. So it's causing microchannel stimulation, or it's causing trauma, which is stimulating your collagen and causing some skin tightening.
This is like something I've always tried to understand. Yeah, it's different from a laser.
Different from a laser.
Yeah, I didn't want to cut you off, but it's different from a laser. But this is something I think that we don't ever talk enough about. We always just talk about how if you injure tissue, it will then get better. Like it's like the entire premise for lasers. It's the premise for like something like a Tixel. It's the premise for a lot of the resurfacing stuff we talk about. But it's important to understand, I think, how those devices that cause injury can actually lead to rejuvenating endpoints. And we always just kind of throw it out there. Oh, it stimulates collagen and elastin. But I think it's really neat to think about how it happens.
It's like a wound cascade event.
Yeah.
Right?
So there's like it's straight up triggers a cascade of wound healing, and in that cascade, the body starts to make cytokines. So cells in the body will react to the injury and then start to make cytokines. So for example, when we injure an area, platelets will show up. Platelets are those little things in our blood that help our blood clot, and they'll show up and they'll start making some things. Like one of them is PDGF, and this is a really popular topic, and I think we'll probably revisit this topic.
Well, yeah.
I know that you and the team are going to be heading out to just go to a meeting that focuses entirely on PDGF. So what is PDGF?
Platelet-derived growth factor.
So platelet-derived growth factor.
Yeah.
So something that comes from platelets that causes growth. Cool. Yeah. So PDGF is just one of many things. There are other types of cytokines, TGF beta. All of these things, though, have a tendency to signal other cells to either come to an area or to behave a particular way. And so when these cytokines are triggered or released due to something like trauma, something like throwing a 450-degree hot iron on my face,
right?
What happens is we get the production of these things, and then those cells
neocollagenesis.
That get recruited, such as fibroblasts, they'll start to make things like collagen. And that's why we kind of always, this is a recurring theme, I think, in the things we talk about, is that we caused injury, but we made it better. And It's just always perplexing. So I think it's nice to just cover that, just so that all of our listeners, I think it's going to come up so many times that I think having a strong understanding that injury done in a controlled fashion is actually the premise for so much of what leads to rejuvenation. Absolutely. And then we can sort of leverage parts of these things like PDGF. We can use what the body creates, but then you can also put it on topically, or you can bring it in externally.
Yeah, you can. And currently we're injecting it and using it topically, and we love it. but it actually pairs well with this. I mean, we'll do the Tixel and then we're causing all those little microchannels. So this is great for like a delivery.
So that super high heat leads to basically microfractures in the skin.
Yes.
And those so the skin normally is like a pretty strong barrier. It is a wall to keep everything out. And that's why skin exists. I mean, we need skin because if we didn't have skin, all the creepy crawlies outside in the world would find their way into our circulatory system. And so the skin is a great barrier. But these technologies, such as the Tixel, some of the lasers we use will create these microfractures in the skin and open up channels so that we can then actually put things topically.
Yes.
And further potentiate the effects that we're not only causing one's own body, but also then kind of adding
using other
to
things. It's a great delivery system for medication. I mean, this one I would say is wonderful it's actually great for melasma. It's not a laser, so you can do it on all skin types. So I think it's a little more safer, I guess, for patients of different.
Because lasers, and we'll talk more about this. We have a whole bunch of podcasts planned to kind of go through and talk about lasers because we do have so many specific lasers in the practice, and I think it would be worth going through. But this technology is not a laser in the sense that it leverages or uses heat applied to the skin. And a laser will also, to some degree, utilize heat, but it doesn't directly apply the heat. It actually delivers energy. And then certain things in the tissue will resonate with that energy. And by resonating or reacting to it, they'll warm up. And then when they warm up enough, you can kind of destroy certain things.
Yes.
Those are like the targets.
With the laser, they have chromophores, and there's 3 main chromophores: water, hemoglobin, and melanin. But this is not a laser, so those are not the target. We're just using that controlled heat. So you can still do a lot with that. What's wonderful with this, like even with microneedling RF, right? That's not a laser. It's an RF device, but it's causing trauma at that same layer as some of our lasers do in the dermis, but you're using a needle. So a needle and a laser both are not necessarily the safest thing for around the eye. If you use a laser for the eye, you usually have to use a shield.
Yeah.
So with this, you don't need one, which is wonderful. I think that's kind of a nice thing about it.
Super safe around the eyes. I mean, Sam did my treatment, and she treated both my lower lids and my upper lids.
Yep.
And maybe talk a little bit about, so I think a lot of people always wonder, oh, that's cool. Is it a one and done? Is it as good as a blepharoplasty? I mean, what about those types of questions?
Yeah. So first, it doesn't it's the eyes. It does a lot of things. So you can do it for melasma. You can do it for crepey skin. You can do it for scars.
The eyes are one application.
But as far as does it replace a blepharoplasty? No. I will never tell someone it replaces surgery. Nothing we do in the med spa space is surgical results.
So many people have, some changes maybe that come with age or sun exposure or this or that. And I just feel like I think surgery a lot of times is overkill. And so these are the types of things that maybe not maybe in the long run prevent surgery from happening, but certainly prolong, the time to which we need to do surgery.
Absolutely. Yeah. And I think too, with some of these things, like even a blepharoplasty, you have a scar. So it depends on where you're at and what.
At the moment, it looks like I may end up with a lot of scars, but that's not the case. What I have right now is a little bit of post-treatment pigmentation and some redness that is just a reaction to the heat that was applied, almost like a little bit of a burn. But that is applied so superficially. It's really at the very surface of the skin. So in a couple days, so by my next podcast, I have a feeling that we won't even see even the remnants of the treatment. Yeah. If we'll probably film in a few days and it'll probably be entirely gone.
Yep. And usually with this one, we like to do about 3 sessions in that first year, about 4 to 6 weeks apart. Mm-hmm. And then usually 6 weeks. And then from there, every 6 to 12 months, I'd say. So there's maintenance with it, but there's maintenance with everything.
Yeah. But the result is, pretty long lasting. I got my first treatment a few months ago. Just because we got too busy, and we're usually the worst patients, let's be honest.
Pretty non-compliant.
Yeah, we finally got around to doing my second treatment. It's interesting. Does it hurt? Yeah. It's a little painful when you were doing it.
To be fair, I don't think I really numbed you long enough.
There's that. And to be even more fair, I'm kind of a humongous wimp when it comes to this stuff.
I just think you didn't numb long enough. Yeah,
no, I'm a wimp.
You're a wimp.
Yeah, we had to bust out the Pronox, and it just, yeah, it was tough, but I got through it. I survived. And I mean, honestly, in retrospect, I don't think it feels like a little lightning bolt hitting the skin every time it kind of goes. And I can feel my skin heat up. And then as soon as you take it off, it's a little burning. And when I got home in the evening, it was still, I don't know, it felt a little bit like the tissue was burning, but not anything more than I've had, say, with a bad sunburn or something like that. It didn't feel beyond that. And today, the next day, I have no pain, zero pain whatsoever. I feel a little dry. I feel a little tight, which is a nice feeling. But otherwise, I have no effects except for the fact that I ran a clinic today and scared the crap out of everybody I saw. I think they thought I got into a bar fight or something, but I tried to explain to everybody, no, this is me getting younger.
Oh, yeah. I like it. Well, we focus more on you have a little area of a scar from something being removed.
Yeah,
so.
I've got a scar right here somewhere, and it's in the middle of all this discoloration right now. But
that was the main focus.
Yeah, trying to continually lighten that up. And we've applied a couple things to it over the years, and it's gotten significantly better. We'll see if we can get rid of it completely. But Tixel, I think, is a great option for tightening and resurfacing.
I think it's great for tightening. I think it's great for eyelids. I think it's great for the melasma patient. Crepey skin, I love it. We had really good results with the neck, actually. But it's not ideal for the person who thinks it's a one and done. Although, to be fair, I don't think a one and done patient is ever going to really be satisfied with any of the things we do in a med spa space.
I mean, unfortunately, I think all of the technologies that we have at our disposal for rejuvenating the skin, I would say that most of them are probably not one and done. Everything's going to require, at some level, maybe repeated treatments and maintenance in the long run. So we'll always kind of go over that when we talk about them. But Tixel's certainly one of those. Nothing can be one and done, right? Because we're not one and done.
I mean, a surgery? Surgery can be one and done, but like you're forever changing.
Oh, absolutely not. Surgery's not one and done. There's no way. First of all, I mean, many operations just to get to an end result are more than one, especially when there's extensive, areas to be treated or do in multiple areas. But even some of the most basic operations where, it is a smaller, simpler, quicker operation, say breast augmentation. I mean, that is a one and done kind of, but an implant's not a permanent solution and it has a lifespan. So after 10, 15 years, the average lifespan of an implant will be up and something surgically will need to be done. And so, yeah, technically speaking, even surgery, our tightening procedures, breast lift, I mean, it's great. We reset the breast, we kind of lift it, get it into a new zip code and get the nipple up there, get the skin tightened. But as soon as we do it, gravity's still there. I mean, I guess if we just move to like a gravity-free environment, then we'd be okay. But that's a tough one to find.
Yeah.
Yeah.
True. Yeah, we like to, I usually in the office, a way to kind of talk about it is most of the patients we see are doing other things too. I mean, they're getting their hair done or their nails or even just your car getting an oil change. I think that's like some of the great ways to kind of put it, that everything requires maintenance. Your hair's forever growing, you get trims, your nails are growing, you have to get them changed. So your skin is your biggest organ. I mean, it
really is. It's
a lot changing to it. The consistency of doing these things are key to your results, I would say.
Well, all I know is I got this Tixel done, and I am pretty excited to see how my eyelids are going to shake out because this is my second one. So I'm hoping to see even more results than I did. After the first one, I actually noticed a pretty big difference.
I did. I really did.
As a surgeon, as a person who operates many hours every day, my eyes are pretty tired. And I can say that as I've hit the ripe old age of 50, I've noticed probably of all things, my eyes are probably one of the most affected things. I really do notice that my eyes look and feel tired. And I even just after one day, I mean, my eyes already feel the skin around my eyes, the orbits, even though you can see it, I know.
Yeah.
Well, they truly does feel snug. And it feels very different than it did a couple of days ago. So certainly looking forward to the longer term result, but we'll see kind of what we end up with.
I'm excited.
Are we going to do more?
Yeah.
I get a third one, right?
Absolutely.
Okay. If I'm nice.
I want to do mine.
Yeah. When are we going to do your stuff?
I don't know. We're going to do it one of these days.
One of these days.
Yeah.
Yeah, but Tixel's cool. Tixel is very interesting because of the fact that it isn't a laser, but it's still an energy-based device. And I think the energy-based devices are so useful in the maintenance and treatment and rejuvenation of skin. I really just can't imagine, in a world where we didn't have those. And, I remember my initial practice, we didn't have access to any lasers or anything. And I mean, we used to do, to resurface the skin, I would do pretty aggressive peels. I remember doing pretty high concentration TCA peels, which are acid peels, and they're very aggressive and they're tough. I mean, you have to gently apply this very, very rough acid on someone's face, and then
the downtime.
Quickly find a way to get it off there. And if it starts leaking or dripping down the cheek or something, you get this line. It leads to pigmentation issues. They're really tough. I mean, certainly you can get amazing results. They're very tricky. And they're, in my opinion, not nearly as predictable or as controllable as the results we can create with lasers, because we're able to dial the settings so precisely. And once you get comfortable with those and you know what they do and what they mean in the context of each patient,
right?
Different skin tones, colors, textures, laxities. I mean, you can really start to tweak the settings.
You can.
Not just on our lasers, but on our energy devices like the RF microneedle, like the Tixel. All these things are very useful because they can be dialed to such precision. And I think it's really nice to be able to obtain those results in that setting. I mean, for me, I think it's a great way to prolong the need for surgery, and we see it every day. I do think a lot of people, especially people who don't want surgery, I mean, I think they're able to get, themselves into a very reasonable place, especially when they get plugged into an initial good treatment plan and a very good maintenance plan.
Mm-hmm. Absolutely. I completely agree with you.
Well, that's our quick and dirty on the Tixel. Certainly we'll be coming back on my next treatment. We'll kind of go through it again, and I'll let you know how it goes. But pay attention on our next episode, and maybe you guys can comment and let us know what you guys think and how it's looking. But today, it's a little rough. If you can, we'd certainly appreciate any input. Feel free to send us any topics or questions. We're always really excited to try to tackle them. And I do believe that it does help if you click the little button that subscribes so you can actually see when we put out our next podcast.
Yay. We can't wait.
Cool. Thanks for joining us.
The content of this podcast is for educational and entertainment purposes only. Although we are licensed medical professionals, nothing discussed in this episode should be taken as medical or legal advice. Always consult with a qualified provider regarding your own health or treatment. We do not accept any liability for decisions made based on the information shared here.